To you all who have joined us on the SAPES Trust Policy Dialogue Forum. Today we are looking at the scourge of corruption in Zimbabwe and the implications of the same on the health sector in particular. And to help us carry the discussion forward, we have two health experts, a former Minister of Health during the GNU, Henry Mazurera, and Norman Matara, also a health practitioner, who will help us just draw some graphics in the health sector to show the extent of the misplaced priorities in our country, where you have millions being thrown around as like confetti by the merchants of corruption on the one hand, and you have our main hospitals, public health institutions languishing in poverty and chronic shortages of even the most basic of medication. Over the last week, in particular, we were provoked, or the public in Zimbabwe was provoked, into consternation when there was published details of a would-be tender for the supply of some equipment worth $4 million, allegedly being awarded to the same person who has been accused of throwing around money and vehicles like confetti. And this has provoked, in part, this discussion this evening. We also have Hopeful Chingono, one of our Zimbabweans who has been on the forefront and has borne the brunt, has been punished for it, for exposing the extent of the health deficiencies in our hospitals and the corruption that is largely responsible for that. So between the three of them, we'll get, in the first instance, a description of the extent of the misplaced priorities as reflected in the health sector. And I now invite Dr. Henry Mazurera to lead us in the discussion.
The health sector in Zimbabwe has been going down for the last decade, and unless something drastic is done, it looks like there is really no hope for giving Zimbabweans some fresh air. The health sector starts at the primary health center, and it goes up all the levels, district level, provincial, to the quaternary levels. And the most important, really, for me as a public health practitioner, is the lowest level, the primary health care facilities that we have. These are the local clinics, these are the district hospitals. And 90% of the people who fall sick and receive treatment in the country do so at primary health care level. And if these levels are not working, then we really have no health care to talk about. We still see people dying of preventable diseases, TB, malaria, HIV. We see people still dying of cholera and waterborne and foodborne diseases. These are all preventable. So when we talk about primary health care, we're talking about health promotion, disease prevention. We're talking about curative health at the hospitals. We are talking about, as we go up the ladder, quaternary and tertiary care. These have all collapsed because of poor funding. So the biggest problem in the health sector right now is funding. And to describe the situation at primary care centers and district hospitals, in fact, the whole health sector going right up to the top, there is no funding. Our clinics and hospitals are relying on out-of-pocket expenditure from the patients. What you pay for is what you get. And people are being asked to pay when they fall sick. The most basic things, like sutures, in a hospital, like antiseptics, medicines, are not available. Just today, I was talking to a patient who was told we don't have anti-tetanus topsoid. We give ATT to pregnant women. We give it to people who have been injured to prevent the very deadly disease called tetanus. And when you begin to have shortages of such very basic vaccines, then the system has collapsed. And everything you use at the hospitals now, you have to buy. And you see a road traffic accident victim coming in and being told to go and buy their own sutures. You can hardly stand up. If you don't have a relative, then it means you are not going to get sutured. And so that is the destruction that we have seen due to poor financing, poor healthcare financing. And I should mention over-reliance on donors also. As donors begin to pull out, we're going to feel more and more of the pinch of the poor healthcare financing in Zimbabwe. And all the pillars of healthcare at the moment are broken down. We're talking about the human resources for health. We don't have enough health workers. We are still working using an establishment that was done in the 80s. There's been no improvement in the establishment of health workers. The health workers are overworked and underpaid. They are demotivated. And that brings in another problem. When workers are demotivated and underpaid, there begins to be a problem of informal charges to the patients. That's an extra burden on the patient. So if you want, care and treatment in the hospitals, oftentimes you find you'll get it only when you pay the health workers, which shouldn't be so if they were properly remunerated. We've got the problem that the government has not looked at the disease burden. We have an increasing burden of non-communicable diseases right now. The donors have been funding the communicable disease component, HIV, TB, malaria, and so forth. But the non-communicable diseases, high blood pressure, stroke, diabetes, cancer, and road traffic accidents has not been funded properly. And we have not seen any meaningful flows of finance with the addition of certain earmarked taxes. We hear there's a health levy. We know there's an AIDS levy. And we don't really see where these monies are going and what they are doing. And I don't think we have any reports really about the amounts of money we are collecting. I hear now there's a levy to take care of road traffic accidents. Well, I think it should have been there for a long time because we've been collecting taxes from cars for a long time. The road traffic accidents are one of the biggest killers in Zimbabwe. So the problem is really financing. We don't see where the taxes are going. And I'm sure somebody will talk about, mines and mining. I live in a mining town. There is no supervision of
Mazorera, you've disappeared. David. David.
We've lost him. We've lost him.
We've lost him.
Yes.
This technology is getting more and more complex now. What is it? Norman, can you take up there until we get Dr. Mazurela back? Norman?
Yes, please. Yeah,
Please
so
carry on.
adding on to what Dr. Mazurela was talking about, yeah, basically the issue is lack of adequate funding in the hospitals, and you also see that coupled with the lack of funding, there are also some populist policies that are put up by government. For example, they say under fives, over 65s, pregnant women, they should access healthcare for free in government hospitals. Whilst these are good policies that protects our vulnerable individuals and that allows them to access healthcare. In healthcare, there is nothing called free healthcare. In governments who put up such policies to allow the vulnerable people to access healthcare for free, they then back up the hospitals by actually paying that service fee, so that yes, the user gets the service for free, but the hospitals get paid by the government. But you also don't see that with our government. They put the policies, but they don't then finance the hospitals to allow the hospitals to give the service for free. So what you end up seeing now is patients will now be getting free access to nothing. They come and they are just told, yes, the service is for free, but we don't have bandages. For pregnant women, we don't have delivery packs. We don't have medicines if you want to go for, say, for a cesarean section. And you end up being given a list of consumables and medicines that you need to buy from private pharmacies if you are to access, let's say, theater for a cesarean section. And you end up paying more by buying things from private pharmacies than what you would have paid at a government hospitals in the first place. Yet the government financed the health sector. And then the second thing we also see is the mismatch between what is budgeted for in parliament and what the hospitals actually receive at the end. So we have the Minister of Finance presenting a budget and saying we have allocated such money to the health service, but that money does not reach the hospitals in time. Like, for example, I've been hearing that this year we are already mid-year, 6 months have gone by. We expect that at least 50% of the money that was allocated to the health ministry in the budget should have been distributed to hospitals. But the money is not coming at the moment. I'm sure we haven't even been distributed more than 20% of what has been what was allocated in the budget. So it becomes very difficult for hospitals to continue running. That's why you see all these problems that emanate on social media everywhere. When you see people visiting hospitals and the hospitals do not have medicines, do not have consumables, and do not have things to use. And I would say these problems have been happening for the last 2.5 decades. I think since the early 2000s, we have been witnessing this crisis in the health sector. But I think at this juncture, we have reached what I can say rock bottom, because yes, we used to see these shortages before, but there are some critical medicines and critical services that we would know even if we were to have shortages in other areas. These things are the at least the basics that you would not found shortages at all at major hospitals in districts and provincial hospitals. I'm talking like things like anesthesia medicines. You know, right now we have people who come up with emergencies, especially those who are in labor, and they need to get a cesarean section. You are told that you have to buy your own anesthesia medicine. That's something which is quite absurd. And some of these things, especially when you are in districts and other provincial hospitals, and you have an emergency at night, and you are told to buy at private pharmacies when all the pharmacies have closed and you have an emergency. So that is something that we had not seen before in hospitals, that we have seen and we are normalizing in the last 2 or 3 years. I think it's something which is quite absurd to have anesthesia medicines being in short supply or in inadequate supply at the moment. And then also, I think when we lost Henry, he was talking about mining that is happening. You know, we have got a lot of artisanal mining in the country, and even in other companies, mining companies, there is no adequate monitoring of the mining that is taking place. And I think this is something which is quite a ticking bomb here in Zimbabwe, because for miners, they are at risk of developing diseases, especially pulmonary diseases, which affect the lungs because of the nature of their work. So periodically, when things are okay, miners should be exposed to tests, X-rays, to make sure that they are not developing those pulmonary conditions. But we are not seeing that being done at the moment. People are just doing their mining, and nothing is being done to actually check if all the things are being done in protocol. So most likely, over the years back then, we are going to see an increase in the number of people getting what we call pneumoconiosis, which is a condition which affects the lungs of miners. Yeah, so I would say in a nutshell, these are some of the challenges
Norman,
that we
where
are
are you
facing in the country.
where are you based, Norman? You're based in Shinoy, is it?
Yes, currently I'm based in Shinoy. I'm a general practitioner doing private practice in Shinoy.
And how long have you been in the sector?
I have been in the sector since 2011. I graduated in 2011, and I've been working as a medical doctor since 2011.
Now, you mentioned that the decline in medical services and in particular supply of drugs has become accentuated in the last 3 years, you said? How do you explain that? What's going on?
Yeah, as I said, for hospitals to work, they need funding. Without funding, nothing works. So you see that from the budgets that we've been getting over the last, let's say, 3 to 4 years, you would get a budget in RTGS when you was still RTGS,
Yes.
and then that budget, you don't get it immediately. You get it maybe 6 months after that, when the money is then actually distributed to the hospitals, and that money would have lost value. So you can't use much of the money. If you had planned to buy certain things with that money, you won't be able to buy the things that you have planned to get. And then, as I said before, those policies where people were allowed to get treatments for free, and then the government could not then back those services with funding at the hospitals. So yeah, those are situations where you have no funding at all, and you have policies where you are forced to treat people for free without any backing. It drained the hospitals, and it left the hospitals without consumables, without medicines, because they didn't have the money to actually buy those things.
Can you draw a close relationship between the increase in corruption and or the misplaced priorities on the one hand, and the decline in the health sector? Are you able to link that? And if you can tell our audience, illustrate it for us, the extent to which this may be so.
Yes, definitely. So when we actually saw the topic, when we are talking about the health crisis in Zimbabwe, to me, I thought, is this a health crisis, or it's just a governance crisis? To me, I think it's more of a governance crisis than a health crisis, because as you talked about, there is a lot of corruption which is undermining the health service delivery. We have funds which should be meant for health infrastructure, medicines, and salaries that are routinely looted or misused. And we have ghost workers, actually. We have ghost workers, not only in the health sector, but across the board. We have inflated tenders. I think we saw during COVID with the drugs scandal. I'm sure, I hope we have a lot to talk about that. We also have procurement scandals, which actually reduce amount of money and consumables that actually reach our hospitals and clinics. And as a result of that, hospitals will lack basic things like gloves, oxygen, functioning equipment, not because our country is poor. Zimbabwe is not poor, but because too much is stolen from the government coffers. And as a result of that, people die from preventable diseases because essential drugs are unavailable. Every dollar that is looted is equal to a surgery that is not done. Every dollar that is looted is equal to essential medicines that do not reach the poor. So yeah, and also corruption. It actually fuels the brain drain and exodus of health workers. You know, people used to know that health workers always went on strike, demanding better remuneration. But the other thing that is forcing people to go out, besides the poor remuneration, is a hostile working environment. As a professional, you are trained to save lives. But when you see people dying from things, you have the skills to save people, but you do not have the equipment, the medicines to use so that you save people. And then you see people are dying under your watch. It demotivates you, and it pushes other people to say, let me go and use my skill somewhere where I can actually save lives than to see people dying. So in addition to that, it pushes health workers to go away and leave the country. And then also something that we have in our country is our accountability systems. They are actually a little bit weak, I think, by design, so that they can loot more funds. As you can see in the public procurement, it lacks transparency. Right now, we were hearing about the tenders to supply cancer equipment and cancer medicines. We don't know what is happening. There isn't something which is transparent to actually say, this is how the tender process went, who is going to supply what, who is going to supply this, at what amount. People, we don't know. We just hear hearsay in social media, but there isn't our government officials who comes out to actually clear things for us so that we can know. So I think this is somewhere where we are also not getting right.
Norman, you said it was a. I'm going to ask Dr. Mazurera just now after we're done with you for the time being. But I wanted to ask you just one question. You mentioned the point that it's a governance problem rather than a health crisis. What would be your recommendation as to how to begin addressing this governance problem?
Well, I think they should be, what I can say, a will from our government to actually make things right. Because I think for now they are just neglecting the health sector. Because if you see the amounts that are needed to run hospitals, for example, I think over the past 3 weeks there has been debate about the issue of blood shortages in public healthcare systems. And then if you go on and look at the budget for the National Blood Services of Zimbabwe, you see that they will need around 10 to 11 million a year, US dollars, to actually work and supply blood to government patients at a very minimal cost. And that money to me is not much compared to what is spent like when buying chiefs' cars, when you are buying government officials' cars. They actually spend quite a lot buying themselves luxury vehicles than what is needed in government hospitals. You know, hospitals like Pararenyatwa, to function fully, they need something like just 5 million US dollars, and they are able to function fully, providing services to hospitals. That money is little.
5 million per annum.
Per annum, yes. for a central hospital.
It's not much.
Yeah.
Oh.
It's not much compared to what they use buying themselves luxury vehicles. So to me, I think it's just a neglect of the healthcare system, and I think the government should commit to put funds to and fund the health delivery system, because I'm sure the country has the money.
Now, I'll come back to you, Norman, towards the end with firm recommendations as to the way forward. That's a pattern of discussion on this platform. We always end up with some very firm recommendations to address the problems that will have been outlined in the course of the hour and a half that we are talking. But here, there's a comment here from someone called the Help Guy. He says, we can talk all we want as long as ZANU-PF regime is still in power, nothing will work. So the question is really, is there anything that can be done under the current circumstances? This is a question to consider towards the end. But now let me return to Dr. Madzorera. Are you back, Dr. Madzorera?
Yes, I'm back.
I'm sorry we lost you for a while, but you were right on the point when you disappeared. And I think maybe I'll just get you back on stream by asking you a very pertinent question. You were Minister of Health during the GNU, a period during which one might say Zimbabwe experienced a lull in the kind of crisis that we have been experiencing the last 2 decades. Things appear to work during the GNU. How do you compare, at least from your sector, the health sector as it was during the GNU and what it is today? What are the major differences and the causes thereof?
I think the major difference is government's willingness to support the health sector. It's really, as Dr. Norman said, a leadership issue. During the inclusive government, we were all committed to improving the social well-being of the people. Privileged to be, leading the Ministry of Health at the time. There was a lot of government commitment. And there's even a stage when I think we nearly reached the 15% of total government expenditure, which we agreed to, many years ago in Abuja as governments in Africa. We nearly reached it. There was a lot of commitment. There was more disbursement of funds to the Ministry of Health than we see today. We were using the US dollar, so the money was meaningful. Right now, we have a lot of trickery where we are told that we have got a ZiG, which is equivalent so much, 26 ZiG to $1 US. These things don't work like that. That is a problem. And then, as my colleague has already said, that money is disbursed late when it has been whittled down by inflation. During the inclusive government, we had all of government very committed. Morgan Tsvangirai was extremely committed to funding social services. And remember, most of the social service ministries were in the hands of the opposition. And because of also the reduction in corruption, we did see an increase in donor commitment and donor excitement towards funding healthcare. Remember, when we went into the inclusive government, there was, I can't remember the exact figure, but it was probably about $5 million of funding that was missing, donor funding from the Global Fund. And the Global Fund insisted that the money be paid back before they can do more disbursements. Thankfully, the government at that time kindly obliged, and they paid back the money that had been taken and misappropriated. And that did build a little bit of confidence in the donor community. And we started seeing an increase in flow of donor funds. And a lot of the improvements that we saw during the inclusive government were really due to the goodwill that we had with the donor community. But there was an annexure to that. We agreed with the donor community that would increasingly reduce dependence on donors and increase domestic funding. And that process started around 2011. And we had a good plan, which we called the Health Sector Investment Plan, well worked out, where we would increase domestic spending. That happened until 2013. And in 2013, when the government changed, we started seeing the domestic funding going down again, while the donor funding was also going down as per program. And so that was one huge pitfall that we went into. It's really an issue of governance. As Dr. Norman said, we are not a poor country. If we make the commitment, we should be able to meet it. We have the resources. We have all the earmarked taxes. We are not seeing them coming to work. That's the major difference, I think, between the inclusive government and this government. There is no real commitment to social services, health, education, and so forth.
Why is this so, in your view? Different kind of people in charge? Different priorities? Yes. What is it?
I think it's a matter of greed. It all boils down to greed. People who are in it to extract as much as they can while they can. And
that wasn't the pattern during the GNU?
No, it wasn't. It wasn't. During the GNU, there was a lot of accountability.
Mm-hmm.
Even when the president wanted to go out of the country and extract a certain amount of dollars from Treasury, I remember Tendai Biti bringing it to cabinet and saying this amount of money is too much. We can't spend so much on one trip. I don't think that happens now. I don't think anybody could ever question.
There's no accountability. There's no accountability now.
No, there isn't.
Yeah. So as I said earlier on, we'll come back to you. We want some firm recommendations, including even whether you think there should be a different kind of content in terms of personnel, in terms of leadership in government for us to move away from where we are now. I'll come back to you, Dr. Mazurera, but thank you very much. And apologies for I lost you for a few minutes, but I hope you're able to follow the discussion. Your colleague Norman did very well to keep up the theme that you had started so well. Yes. Now, Hopewell, before I bring in, I want just to leave a question for Dr. Mazurera. Dr. Mazurera, you have stated, this is for you to consider later on, not now. This is just one of the chats on the platform. Dr. Mazurera, you have stated the real issue behind the reason why our healthcare is in this dire and deplorable state, unwillingness. Maybe you want to elaborate on that later on, Dr. Mazurera. Then there's another comment. Dr. Madaza, I think this is the type of discussion we must always have. Very educative and interesting. But your platform needs to be more advertised. Maybe Mkomo Hopeful can help us to transmit these messages. Hopeful, it's your platform now.
No, thank you so much. And thank you to the previous speakers, the two doctors. Dr. Matare, who is with Doctors for Human Rights and former minister. Now, we have a big crisis, Professor Madaza, in Zimbabwe, and this crisis is rooted in governance, as Dr. Matara said. It's an issue of corruption, bad governance, and at the apex of the country's executive is a leader who does not care, who does not show any empathy at all, because if you look at the figures that are needed to run the Ministry of Health, and then you look at the amount of money that is being looted every year, both accounted for and unaccounted for, you realize that the Ministry of Health will need very little and it will function well. I set up an organization called Save Our Hospitals in 2019. And when I was working with that organization, I realized that we've got 6 referral hospitals, which are commonly called central hospitals in Zimbabwe. It's Parenyatwa, Salim Gabe, which used to be called Harare Hospital, Chitungwiza, and down in Matabeleland, we've got Pilo, United Bulawayo Hospitals, and the referral hospital for mental health in Gucheni. So it's 6 of them. And 6 of them require only 60 million to run without any shortage at all from January to January. They need only 60 million US dollars. And if you look at the amounts of money that are looted under Mnangagwa's presidency, 60 million is nothing, it's a drop in the ocean, which means that the money is there. The crisis is not so much about health, it's about corruption, the stealing of public funds. I went to prison 3 times after exposing this looting, and the specific issue that I focused on was COVID. This was a 60 million fund where the president was dishing tenders, not even tenders, because they were not going to tender. The Public Procurement Act requires people to go to tender, but he doesn't believe in the tender system, and he said so privately to so many people. And what then happened was you ended up with bogus companies which were not even registered. Some of them, you would find the address in Dubai, it's a 1-bedroom flat. The address that was used in Hungary, again, was a 2-bedroom flat in an area like Mbare. And so this was deliberate on his part, on the president's part. And I think a lot of the times we speak avoiding to name the problem. The problem is Emmerson Mnangagwa. He's the one who has authored this corrupt system where he creates criminal cartels, which then use the crisis or the crisis in Zimbabwe to loot public funds. If you go into hospitals today, there are no medicines, Professor Mandaza. Patients, as Dr. Matara said, are asked to buy their own medication. There is no equipment. I've been making so much noise about radiotherapy, cancer treatment machines. During Dr. Madzorera's tenure when he was Minister of Health, between 2009 and 2013, under the so-called GNU, he procured 3 cancer treatment machines. When they broke down, nothing was done. Zimbabwe has gone for over almost 4 years now without a single working radiotherapy cancer machine, and thousands of people are dying. And we've gotten to a point where one says, you know what, even if you use your corrupt system, at least buy the machines. But he doesn't do that. He doesn't buy the medicines. Dr. Madzorera talked about the Abuja Declaration, where African governments agreed to make sure that the health sector is given 15% of the budget every year. This doesn't happen. The last time we had a higher, I think, figure was 9%. But this 9%, as Dr. Matara said, is in RTGS or ZIG now, and it comes late. By the time it comes, it would have been hit by inflation. But the reason why it comes late is because they take this money, they use it for other things in their businesses, and then they bring it back when it is worthless. And even the little that is put in the health delivery system, it's looted. You find that medicines are bought. They are taken to NatFarm, which is controlled by the government. And when you talk to doctors and nurses, the medicines never get to the hospitals where they're supposed to go. So we have a dysfunctional system in terms of procurement of medicines and delivering them. We've got a dysfunctional system in terms of medical equipment like X-ray machines. I mean, Dr. Mandaza, you've got a home in Kariba. God forbid, if you are involved in a car accident in Kariba, there's no X-ray machine there. They would have to take you to Chinoi or take you to Zambia. Most people in Mashonaland West, including Kariba, are now going to Zambia for treatment. I've talked for years about the tragic reality of 2,500 women dying every year giving birth. And these are the recorded figures. They're actually more because some die in their homes. They don't bother to go to Pararenyatwa or any of these hospitals because there is nothing there for them. The biggest hospital in Zimbabwe is Salim Gabe Hospital, because Pararenyatwa is a group of hospitals. So the biggest hospital in Zimbabwe is Harare Hospital, now called Salim Gabe. It has only one maternity theater that is working. Ian Smith built 2 maternity theaters in 1977, and there's only one now that is working. At some point, there was no maternity theater at all working. So the one that is being used was built by Ian Smith. And when there was no maternity theater working anymore, Stanbic Bank had to step in and refurbish the one that is working. And do you know how much the refurbishment cost? It's only $37,000 US. If you look at the land cruisers that the government procures for government officials, one land cruiser can refurbish and build and refurbish about 10 maternity theaters. So it's about the lack of political will to make sure that we save lives. Now, this has had an overspill, which has created a crisis within the region. 70% of women giving birth at Musina Hospital, according to the figures of the South African government, are coming from Zimbabwe. And it creates flashpoints for xenophobic attacks. We've been seeing social media videos of South Africans attacking Zimbabweans at health centers, at clinics, and at hospitals. But this problem is authored in Harare by Emmerson Mnangagwa and ZANU-PF. And if you go into certain parts of South Africa, Zimbabweans are now being totally denied access to health by vigilante groups. And if you go back to where we started with Dr. Mazorera and Dr. Matara, the money is there. And the money that is needed is not actually a lot of money. It's money that is within. I mean, look at the sugar tax, Professor Mandaza. It's about 6-7 million. Over 10 months, you've got enough to run all your central hospitals, but that money is not going there. If you go into Pararenyatwa today, ceilings are collapsing. There are no gowns for doctors and nurses to wear during operations. There are no basic things like Sechu. We remember Dr. Mashumba, who cried in front of the former health minister who got fired after we exposed his corruption, Obadiah Moyo. Dr. Mashumba cried asking for bandages, for sutures, and this is in 2019. And now we are in 2025, and nothing has been done. Things have gotten worse. Nurses at some hospitals like Harare Hospital, they are working 3 days a week, which means there's a shortage of staff. You go there, sometimes there is no water. They're supposed to carry out a surgery, they've planned everything, and they are told that, oh, sorry, they tell the surgeons and the nurses, sorry, there's no water, so the operation cannot go ahead. Now, if you look at even people who are living in rural areas, when you have an emergency, you're supposed to call your district hospital and an ambulance is sent. But these ambulances are not there. They use coach carts to take people to hospitals which are dilapidated at district level and which have no medicines at all. The other problem is those that attempt to do something about it, as long as they are not part of the regime, they are not allowed to do so. I got a donation of 40 dialysis machines from Birmingham, NHS Trust. They're still sitting in Birmingham because the government won't do it, simply because I'm not part of the corrupt cabal. Today, between Harare Hospital, which is Salim Gabe Hospital, and Pararenyatwa Hospital, at any given time, there are about 9 or 10, up to 15 dialysis machines to service a population of over 2 to 3 million people in Harare. Chitungwiza does not have a dialysis machine at all, and yet it's a central hospital. So people are just dying from easily treatable diseases. And when you look at the crisis that we have today, if you go to cancer, over 3,000 women are dying from breast cancer. And these are government figures. It could be more because some people don't even have the money to go for diagnosis. If you go today for diagnosis, you are told that the MRI machine is not working. It means you have to go to private sector. To use a MRI machine in private sector, you're talking about $1,500 to about $2,000. A university professor at the University of Zimbabwe is earning $230. It makes it impossible for any ordinary person to have access to good health. Now, if you look at the figures, the Zimbabwe Anti-Corruption Commission former chairman, who's now the director of national prosecutions, Lois Matanda-Moyo, she said what she can say on the record is that $1.8 billion is being looted every year out of Zimbabwe. And is being looted by those that are in power. This is the person who is at the center of this regime, who's saying she has found out that $1.8 billion is being stolen. What can it do for us? $1.8 billion. Central hospitals, they need only $60 million a year. $600 million can run all our central hospitals for 10 years. And yet, Lois Matanda-Moyo is saying they are actually losing 1.8 billion, which is on the record. It's actually more. So what it means is that what they are losing can run the central hospitals, Parenyatwa, Harare, Chitungwiza, Mpilo, UBH, and Engucheni for 30 years. That's why I agree with Dr. Matara when he said this is not a health crisis issue. It's a governance issue. It's an issue about a government and a president who is so deep into corruption and running criminal cartels that he has no interest in making sure that he does the bare minimum. You go to a central hospital today, Dr. Mandaza, your offices are next to Parenyatwa Hospital. You will not get painkillers at times. Sometimes you can't even get things like tape to put around a hand and when a cannula is put there. There was a video that was going around on social media where they use bread plastics from Lobels to tie a cannula. That's how despicable this regime is, and that's how much they don't care about these people. And those that have access to the medications that are taken to NatFarm, who are part of this regime, they steal these medicines. They end up in pharmacies that belong to people or wives of people who are part of this regime. So you go to a hospital, they will say, Edaipane pharmacy, Pam Sorap, and that pharmacy is owned by somebody or by a wife of somebody who is part of ZANU-PF. So I think for now, I'll leave it there and then allow others to step in.
Yeah, before you go, there's this recent case about which people like yourself warned us in advance when one of the ministers was pleading with the Mnangagwa to have a look at the hospitals and the dire condition in which they were. This about 2 or 3 months ago. And you warned then, as did others, that this might be a prelude for a corruption saga. Were your fears borne out? What happened subsequently in the announcement of this?
Yeah, thank you,
tender?
Prof. Yes, indeed. As I had warned, the president created a bogus, a fake. He said he had done an unannounced visit. Actually, that visit was well planned. We know. We spoke to the senior officials at those hospitals, and they told us that the visit had been planned. The president has got his criminal cartels that he uses to loot public money. So one such cartel is a guy called Chungwarara, who is so-called presidential advisor in Dubai, and he runs a bogus company. I did an investigation on this and I posted it on social media platforms. This company is domiciled at apartments as usual. And the funny thing about Emmerson Mnangagwa's corruption is not sophisticated. He doesn't care. At least Mugabe tried to camouflage it, but he's so crude, and it comes across his lack of education, his lack of sophistication. It comes across when you look at how these cartels operate. So this Tungwara guy, the day Mnangagwa went to Parenyatwa and Harare, he then said this was an unannounced visit, and he said he wanted to see the hospitals for himself. The infrastructure is collapsing and blah blah. The stuff that we've been saying for over 7 years. And what happens after that is when he leaves the hospital, this Tungwarara guy moves in with his teams. This was choreographed. It was pre-planned. This tender was given to this guy to do refurbishments. We don't know how much exactly he has gotten, but we know that it's an inflated tender. It's not even a tender because it didn't go through the Public Procurement Act requirements. It was just given to him. So this is systematic, and it happens in every sector. It's not only in health. It happens with roads. You complain about roads, you get his guys to form bogus companies. He gives them contracts. They do a short job. You complain about hospitals. He does the same thing. You complain about access to water. You give the same guy got a contract for drilling boreholes. He got a contract for doing that wall at State House. And you know how much he was paid? $15 million to build a wall. Now imagine how much that can, the type of house $15 million can buy in Hollywood. But that's the way they loot. And that won't stop until someone puts their foot down, until we have an opposition, which also has a problem. Because the opposition, and I think Dr. Mazorere can touch on this when he comes back, the opposition controls hospitals. It controls in Harare Wilkins, it controls Beatrice Road. I've been in touch with the mayor and I've told them that, there are these people that are willing to assist. There's no desire to do anything. 2 years ago, I wrote a paper for them. I got a radiotherapy cancer machine in California. I got dialysis machines again. They didn't move in. So we have a political elite crisis of people that do not focus on these issues. Because in order for Mnangagwa to be stopped or to retreat, you need an opposition that is strong, that is able to do the job that people like Dr. Mazorere used to do when he was still in parliament, when he was in opposition. And you need this kind of discourse to become normal. Unfortunately, our people, you find that you talk about fake prophets, they come, they rush. You talk about important discussions like the one we are having here. It doesn't entice them anymore, and I don't know why. Perhaps Dr. Mazorere.
Well, the good news is that we have 142 people on the platform right now.
Well, that's good.
And people are sending in their comments. You are doing a good job, not only on this platform, but otherwise you have been doing a good job. And I think one of the reasons why there's such a good turnout is because we have you on this platform, along with the people like the medical experts, Mazorera and Matara. So and I'm very pleased myself with the response and the extent to which people are responding to this thing. But the question I have for you, and I've raised this many times in our own discussions, why is it that corruption is now on steroids in Zimbabwe? I mean, you mentioned Matanda Moyo saying 1.8. On this very platform a few months ago, BT mentioned 7 billion a year over the last 10 years, $70 billion. And we asked him on the occasion, where was this money? And he said that money was stashed away in places like Dubai and Mauritius. And subsequently, I heard from a colleague in Mauritius who said if Zimbabweans would withdraw their money in Mauritius, many of the banks in Mauritius would close down. So you have a situation where most of this looting is being stashed abroad, and we on this platform have made it one of the objectives of the transitional authority that we must cause a repatriation of these monies. The figures are running into, I mean, if Tendai BT says 70 billion over the last 10 years, 7 billion a year. Someone other day said 4 billion a year, and they have Batanda Moyo 1.8 billion. But the question I had was, why is this so? What is the cause, in your view, of this spectacular campaign or scourge of corruption? How do you explain it?
Thank you, Professor Madaza. I think the big problem that we have is as they say, the fish rots from the head. The problem that we have is we have a criminal president who doesn't care, and we've got a cabinet that doesn't exist. Dr. Mazore talked about how Tendai BT used to intervene in cabinet meetings, and when money was being stolen or you looted through trips to go abroad. Today, because of the nature of the mindset of the person who occupies the presidency, Emmerson Mnangagwa, this has become out of control because it's quite clear now that Robert Mugabe, as bad as he was the guy who used to restrain them from doing the kind of things that they are doing now. Because under Robert Mugabe, there was corruption, but it did not reach to these scary, frightening levels. And there was still a modicum of respect, the state wanting to be seen internationally as the legitimate state of Zimbabwe. Now they don't even care. You find generals being paid to do private work using soldiers who belong to a state, and this has been going on for a long time under Emmerson Mnangagwa. The other thing is the scarcity mentality in our country, where people think they have to take everything that is available because tomorrow there might be nothing, and yet they do this at the expense of the citizens, depriving them of healthcare. I mean, if you can't get a painkiller in a central hospital like Pararinyatwa, how low can you go? But unfortunately, under Emmerson Mnangagwa, I would argue that we have moved from the gutter into the sewer. We were in the gutter with Robert Mugabe, and now we are in the sewer with Emmerson Mnangagwa. And this won't change because he wants to be in power until 2030, or to install his own puppet who will continue with this kind of looting that has been taking place under his watch.
And there's no opposition to leverage against such levels of corruption. If anything, as you have indicated, elements of the opposition are in fact party to this kind of looting.
Indeed, elements of the opposition are party to it.
What shall we do instead of just talking about as we have been doing? We have held many sessions on corruption on this platform. What can be done to stop this? What can be done?
I think what is needed is a united front. The political parties in the opposition have failed to provide a united front where, citizens go into the streets to complain about hospitals today. You can't shoot people for demanding healthcare, and the world is watching. In South Africa, they are fed up with us accessing their healthcare system. If there is a protest against the abuse of public funds and against the dilapidated healthcare system, they cannot shoot people for that. And besides, the job of the opposition is to organize us. We are not politicians. They're supposed to organize us, People cannot just go on the streets on their own. They need to be organized. But unfortunately, as you mentioned, parts of the so-called opposition are in connivance with Emerson Mnangagwa's regime. So a good example is a scandal with Geo Pomona, where they're getting $90,000 every month, $90,000 every day, for literally doing nothing. When we made a lot of noise, they went to Belarus, bought some trucks using government money. The cost of those trucks is inflated. And when you ask the mayor, who is supposed to be opposition, to say, why did you sign off this? You do not get a straight answer. So ZANU-PF has captured what used to be the opposition, and they get crumbs from the table, and they keep quiet. So people must organize themselves. People like yourselves, Professor Mandaza, in the past, you've been able to organize a national dialogue. I think that is what is needed. And from there, something can emerge. We cannot rely on the political parties because they are incompetent. Some of them have been trapped into ethnic alliances, which is quite unfortunate for a country like ours, which claims to have educated people, to reduce our politics to tribalism. But that's the problem we face. And I think the answer now lies in a national dialogue that can bring people together, regardless of where you come from, what language you speak, what skin color you have. Our problems in Zimbabwe affect all of us in every region. And I always warn people that do not say Emerson is doing this for the Karangas. It's not. If you go to Shawane, where he comes from, they are suffering equally as in Murewa, where I come from. He's doing this for himself, his family, and his criminal cartels who are his friends. So it's important for Zimbabweans across the country to unite and demand a working country. The money is there. Zimbabwe is a very wealthy country, but there's no political will. And the other apex is a criminal president.
Well, you know that we are on the NTA process, which is part of the national dialogue that you're talking about. Precisely because we see the dearth of opposition, not only the dearth of opposition internally, but also an international community, in particular the former colonizer, Britain, which has become increasingly silent on these issues of corruption. Was at the King's birthday a few days ago, or a week ago, and it was incredible the contrast between the U.S. position a week earlier, in which the ambassador of the U.S. spoke of corruption as a cancer in Zimbabwe, and by contrast, no mention of the word corruption at all by
I don't think
State for Africa. You know, it's really, I mean, this kind of and Africa Confidential has a report today in which it is claiming that the British policy on Zimbabwe is more or less appeasement, focus on business, in particular mining, and put aside this whole question of governance and even corruption for that matter. So you are based in the UK right now, are you?
Yes.
I mean, what is the mood? I mean, we have many Zimbabweans there, as you are aware. What is being done out there to put pressure on countries like the UK, in particular, to keep this subject of corruption alive, at least? And as you know, part of the what can I say, palliative factor in the Zimbabwean crisis is the role of the diaspora and the nearly 2 billion a year which is sent home, which has really helped to cushion the social stress in our country. So in many respects, the diaspora, people like yourself, are an important factor in addressing this very problem we're discussing today. And that's why we brought you here. You can speak out loud as you are in front of a platform. We have up to 20,000 followers on this platform. What can be done to synchronize opposition the word opposition is too strong, the public consciousness of these problems, such as corruption. Synchronize this consciousness between people in the diaspora and people at home. How can we do it? How can we keep it alive? To a point where we can make corruption a self-evident crime. One of the things which has worried us, I remember the famous PISMA scandal some years ago. And I did a report for the Transparency International. And I made a recommendation that one way of attending to corruption is to make the culprits pay back public funds. You remember the PISMA scandal was about $30 to $40 million. It has never been recovered. How can we institute something, even if we have to use international organizations, to help us put in place systems which can ensure that corruption is stemmed on the one hand, but at the same time that we ensure accountability for the billions that have been lost so far in our country? What is your view, Opul?
I think the biggest problem that we face now is the incompetence with political elites, both ZANU-PF and the so-called opposition. And each time someone tries to do something, they are viciously attacked by both sides, because the so-called opposition thinks that you want to take their space, and ZANU-PF, or naturally, they want to protect the space that they occupy at the present moment. There are a lot of things that can be done. You can mobilize Zimbabweans to even march to the Zimbabwean embassy in all the countries that they are. In Britain, we cannot rely on the government. It's quite clear that the British embassy in Harare has taken an appeasement route. They don't talk about corruption like what the Americans do. And this is mainly because after Brexit, they're looking for new markets. So human rights is no longer a big issue for Britain when it comes to Zimbabwe. They'll just say things so that they can be they can go out there and say we've said something. But corruption is not a big issue. The Zimbabwean corruption is not a big issue. They're more interested in appeasement and getting access and leveraging the gains of and I think, as I said earlier, people like yourself, I remember about 10 years ago, you invited me to a conference. I think it was 13 years ago. You invited me to a conference in Victoria Falls with Dr. Mungai, who was the country manager for the World Bank at that point in time. And the conversation or the conversations that you were holding at that time, they need to be activated and accentuated. We need a situation where there's a rallying point that people can say, whether it's an NTA dialogue or you call it whatever it is, there is somewhere where people can go and they say we can rally behind this thing. Right now, there's nothing that mobilizes people. There's no political force that is able to mobilize people because they don't exist. But if they come into fruition, mobilization will be so easy. If you go to South Africa, every day I get messages of people who want money for healthcare. In Zimbabwe, it's the same thing. The diaspora has got a responsibility to be part of this discussion, because the diaspora itself is suffering because of the crisis back home. The money that I will use to pay $500 or $1,000 for a cousin who is not well, it's money that I could have used for other things. So this crisis affects everyone. Many people assume that it doesn't affect people who are outside Zimbabwe. They're actually affected because they have to pay all these bills. Dr. Matara and Dr. Mazorere talked about how patients are asked to go and buy medication as basic as betadine or even paracetamol. And these patients do not have the money. And that money comes from the diaspora, which brings in, I think, about $1.8 billion US, the same amount of money that's stolen.
Almost 2 billion, yes.
Sorry?
It's almost 2 billion now.
Yes,
from the
yes.
diaspora. Yeah.
So I think that mobilization, people like yourself, you are not political actors. Everybody knows that Professor Mandaza is not interested in becoming a president. So you become more, you have integrity that the political actors do not have. You and others like yourselves are the right people that can bring people together, have a national dialogue. It's not partisan. It's looking at the issues and then coming up with solutions on how we can deal with this. Otherwise, we will continue having these conversations without action. Nothing will change.
Yeah, we're getting to that, Opal, and I'm going to rest you for a while and bring you towards the end as the last word on the way forward. You are aware of our efforts at the National Transition Authority, which is based precisely on the observations that you have made, namely, and that other doctors have made the same observation, that we have a problem of governance. We have a state which is lacking in capacity to address social distress in the country. We have a state which has confused priorities, if any. And something has to be done about it. We have this modest attempt at a transition authority which has been pushed over the last 10 years. We think we're getting there, and we are planning a national conference in a few weeks' time. But we need the support of people like yourselves in the diaspora and at home. And on that note, I want to ask the doctors again, beginning with Dr. Mazorera, what can be done in addressing the governance problem, in addressing the corruption problem, in beginning to put in place a process, a system through which we can redeem our country and make it great again. Dr. Mazorera, what can you tell us?
Thank you, Prof. I'm glad the issue of leadership and governance has been highlighted, and everything rises and falls on leadership. All of Zimbabwe's problems are a leadership problem. And unless we're able to put in leadership in the country that is committed to fairness, to integrity, and to improving the welfare of every Zimbabwean, we will never be able to change anything. It's an issue of who's got the power and who doesn't. Zimbabweans are not able to forcefully remove the government. And that's why we always pin our hopes on elections. But then the elections don't work either. They're always, rigged. And we've had many elections when, we don't even know how many votes the winner got. What kind of an election is that? Our esteemed colleague asked a question or said something about opposition members in parliament, in local authorities who seem to be working in cahoots with the government. Well, my own view is that there is no opposition in this government. Either you are for ZANU-PF or you are not in government. I am the properly elected mayor of the city of Kwekwe and the president of the Urban Councils Association of Zimbabwe. I served for only 2 months, and I was told in 2023 that I'd left my party, which brought me into council, and therefore I'd been removed from council. Together with many, many other colleagues like Ian Makone and so forth. If you are not working in cahoots with this government, they will just remove you. They are not using the law to remove you. They will create a ghost that will come and say, you have done A, B, C, D. And the word of that holds because the ghost has been created by the people in power. So that's why I'm the mayor who is not going to the chambers right now. And so I hope that answers the question. There is no opposition in government. And if you oppose, a ghost will be created for you and you will leave office. So
have you heard about the proposed National Transition Authority that some of us have been talking about? And what would be the response of the doctors, for example, professionals, to that kind of initiative?
National Transitional Authority. I've heard about it, but I've not really, followed the details. But that's the way to go. We need a transitional authority that will be able to lead the country out of this miry clay in which we lie, and then, conduct proper, free and fair elections.
Yes.
I don't know if that is the concept.
Well, we hope that people like yourself, leaders like yourself, you are a leader, Dr. Mazorera. You have played your role in this country, and that's the reason why we brought you on this platform. We are appealing to you and all others like yourself, especially in your profession, to help us put together this process of redeeming our country. So we hope that in the next few weeks we'll be in touch with yourself and others to help us on this journey. And therefore, I'd like to thank you for joining us today and to say that we are now in touch and we'll keep in touch. And on that note, let me move to Dr. Matara. Matara, have you heard anything about, you are coming from the Zimbabwe Medical Doctors for Human Rights. Have you heard anything about the National Transition Authority or attempts at doing something that can redeem our country and address that which you had highlighted as a governance problem in our country? Dr. Matara.
Yes, so yeah, like Dr. Mazorera, I've heard about it, but I'm not privy to much detail about it.
Mm-hmm. So we will be in touch with you on it to see whether we can. In fact, yesterday we had a meeting, and there is medical doctors among us who will be in touch with you to see whether we can form a professional medical practitioners forum, which can become part of the organs of the proposed national dialogue, national conference in a month or two from now. Again, I'd like to thank you for assisting us in this process. And then last but not least, back to Hopewell. Hopewell, can you put some kind of proposals on the way forward?
Thank you, Professor Mandaza. I think the most important thing is for us as Zimbabweans to unite around common values and to mobilize around issues like this one. The two doctors that are on the panel have told us how bad things are, and most of us are aware of how bad things are because we go into these hospitals. I know that Professor Mandaza, your offices are next to Paranatyako Hospital, so you're quite aware of the problems that are there. And I think we now need to move away from thinking that this government is going to do anything for us. It's not going to do something for us. We need to mobilize. We need to have a national dialogue, something that can be used by, I would say, the international community to then see how they can help us. When you speak to most African leaders today, they say, we cannot come to Zimbabwe and tell Mnangagwa what to do when there's no crisis. We need to see a crisis. And that crisis, the only way you can make it visible, because it's already there, it's only that it's not visible, is by focusing on it, accentuating the voices that are talking about it, and not becoming one main thing or just 3, 4, 5 people talking about it, because you end up looking like you're mad. But the nation needs to find somewhere where they can go and where they can be led. And I think a national dialogue is an important factor, and that can be used to then bring up these issues and make sure that those that are in power are not only asked to listen, but they are forced to listen.
Thanks, Hope. Before I thank you formally, the three of you, just to read some of the comments here, the chats. Enough is enough. Zimbabweans, let's stop this rot. And the Mbata says, Kenya is on the streets now. Why are you Zimbabweans failing to fix your country? Then Help Guy answers, he says, when comparing Kenya and Zimbabwe, it's a bit unfair. Zimbabweans have been fighting the regime for the past 3 decades. People are being abducted and never to be seen again. They get tired, and of course, many have left the country. Right now, as I've always said, we have some like 6 to 7 million people outside the country. And in particular, the professionals, up to about 80% of our professionals, like yourselves, it's one of the unusual situations where we have, on this platform alone, more people at home than in the diaspora. Otherwise, most of our audience now is in the diaspora. So, and someone is asking for the referral link. The referral link is there. You can look at the banner below the screen. Support the channel by liking the video and subscribing to the channel. And out of this channel, we are also having a website through which to link up with yourselves, the viewers, and participants in the policy dialogue, and also to create a membership. There's a membership around what some of our grassroots people have said should be called the NTA Now. And so we'll be keeping in touch with you, all of you, and I want to thank Dr. Madzorera, Dr. Matara, and my young brother, Hopewell, for helping us in this discussion, which has attracted more than an average turnout. And I think it shows the level of interest in the crisis that is afflicted Zimbabwe for a long time. And likewise, we'll like to think that there's a lot of thinking going on in terms of the need to do something about it. And we are trying in our own way to do that. But thank you. Until we meet again in a fortnight, goodbye. Thank you.
Thank you.